Good afternoon, Team Robbins. We're with Installation Commander, Colonel Brian Moore, and his chief, our chief, Chief Weezer. We're going to take this time today just to ask you a few questions that have come up through our Facebook, through media, so that you can tell us what you think is important, what people should know.
Great.
Colonel Moore, thank you.
Well, good afternoon, and I appreciate the opportunity to answer some of those questions. Let me just start by saying, this is a team sport, and it requires cautious courage on everybody's part to meet the objectives of our missions, our mission partners, yet take care of the people that are at the highest risk and take care of the people that are risking their own personal well-being for the sake of national defense and the mission. So it's a great opportunity to be here, and I'm very appreciative of being able to answer these questions. Chief?
Thank you, sir. Appreciate it. I just want to say thanks to Team Robbins, thanks to all the family members, thanks to the community for leading during this time. Thank you for your grit and your determination on keeping Robbins the best place to live, learn, work, and play. Sir?
With that, let's start with the first question. Specifically, what precautions are being taken at Robbins to reduce the spread of COVID-19?
So that's a great question. So many have heard of health protection condition levels. That's been put out through the Center for Disease Control, as well as here Colonel Farrell and her medical group. And those different precautionary measures, range from anything from social distancing of 6 feet all the way up to considering restriction of movement and access. Right now we're in health protection condition Bravo. However, I'll tell you that we've also instituted and considered all the higher level conditions. So for Charlie, for example, we've already looked at restriction of access and control for those critical missions that must continue, but also for making sure that we understand the vulnerability of the folks that are here on the base and the missions that they're performing. In terms of some of those precautionary measures, we've put sanitation in the entryways and exits of every facility, and we've limited access to those facilities in order to make sure that people are adherent to those. And then lastly, I would say we've asked every commander and supervisor to pay attention to how well their staff and employees are thinking about that on their own individual terms. Are they maintaining those social distances? Are they washing their hands? Are they using the sanitation? Because that is being cautious for everybody else. So we're looking at all those. We'll continue to assess that in every situation, and commanders and supervisors are empowered. Individuals are empowered to hold each other accountable to make sure we're living by those CDC standards.
Right. For those who cannot work from home, especially maintenance shop and flight line workers, are they able to do their jobs while maintaining CDC guidelines for distancing? What is the base policy for this?
Yeah, that's a great question. Because when we look at the different roles and responsibilities and mission sets on this base, there's a lot of them. So, you bring up the idea of the concept of the flight line workers. I completely understand that, I'm a flight line maintenance officer myself over a career. And when I think about that, I understand what it means to work on an aircraft, and the complexities of trying to maintain distances, follow engineering guidance, follow the technical data, and yet still consider the person you're working with in order to maintain safety. So the policies that we've put in place apply to everybody. General Bunch was clear, installation support as well as flight line activities are mission essential to make sure that this sustainment, this defense industrial base can continue to move forward and meet our nation's call. So the answer to that question is yes, we can absolutely follow the CDC guidance, but it takes ingenuity and creativity from every member in every shop to make sure they're thinking through the best ways per their own mission sets to be able to then adhere to those policies, right? And that's no easy task, but it's the task in front of us. And we should cautiously and courageously meet those tasks head on in order to meet our mission accomplishment, those national defense imperatives that every commander on this base has to think about. So the policies are in place. We empower the commanders to do those policies, and then it takes supervisors to really think through each of their processes in order to make sure they're taking care of their people to the maximum extent practical. Chief, any thoughts there?
Yes, sir. That's for the flight line. There's also other members on this installation who are mission essential as well for our national defense strategy. I want to say the same. Be innovative if you are coming to work, because you cannot telework. Be innovative and make it happen, because you are important to our defense strategy and making sure this installation continues to move along in this time of crisis.
So in addition, as a maintainer, I understand that there's certain circumstances where not every single policy is going to be able to be fully utilized, but that's why it takes everybody to institute all the other precautionary measures that can potentially be applied. So if there's a case where two maintainers are working together to accomplish a mission and they have to break that 6-foot rule, well then how have we done in terms of washing hands, in terms of thinking about how we're interacting with that person? How well have we done in terms of previous social activities to make sure that we're thinking about those other people that we're working with? I think that's pretty critical, to put others before ourselves. And the last thing I would say about this is, there's a risk assessment that individual supervisors and commanders have to think through, right? Because there's a lot of variables that come into play in any different given mission set. So when you think about risk, what is the probability based on the person you're working with? Who are they? Get to know them, connect with them, understand what their risks are. Are they in a higher risk population, a lower risk population? Are they healthy? We don't want to ask specific medical conditions, but at the same time be cognizant that some people have different medical conditions than others. If they're in a lower risk population, then maybe there's certain activities that you can weigh and assess and get the mission done, because risk really is the idea of the difference between probability and the consequences of those actions. And every supervisor and commander should think about all the variables associated with whatever task they're doing, and then apply that in a very well-informed, cautious, but courageous way.
Are COVID-19 tests being done on the base? If so, who is eligible?
Yes, they are being done on the base. If you are an empaneled member on this installation, you can get a test. Our wonderful medical group individuals and teams there developed and created a drive-through clinic for anyone that's empaneled on this installation to get tested at any time. Sir.
Yeah, and I'll add to that a little bit. The team that came up with that, they came up with an innovative solution for those folks that are at higher risk that need to be tested, right? And so they did a great job. And so to the Chief's point, we have to keep people thinking. We've got to think our way through this to protect each other. And so as we test people, as we administer pharmacy type implications, as we work on the flight line, we need every supervisor engaged in thinking through the best way to accomplish that. And Chief's right, we're doing that in the medical clinic, which is a clinic, by the way. It's not a hospital, so that capability is smaller than a regular hospital, but they're accomplishing a great deal to protect the people empaneled on Robins Air Force Base.
So we're talking about most of the military people who are empaneled here. We understand that. Please tell me what you would say to civilians who are not.
I would say be in contact with your medical provider, right? The professionals in the community are doing a great job. And in fact, we're in contact with them all the time, every day. I'm meeting with the mayors, Mayor Toms, Mayor Harley, Mayor Walker, and the chairman are doing fantastic work along with the medical professionals to help take care of the civilians on the base as well as the community. This is a team sport, and we're better together. So, and so we're in constant contact, making sure. But I would say stay in contact with your medical providers if there's concerns, and follow the guidelines of the CDC.
Thank you. At what point would Robbins increase the health protection level? What would that mean for employees and workflow?
Yeah, so we have declared a public health emergency here on the base. And that's as a result of the 2 cases that we've had. And that's reason enough to do that. We're currently in HPCOM Bravo, but like I said, we've already instituted most of the Charlie measures, and we're going to continue to assess those. Right now, we're doing a great job. Everybody out there is doing a great job of mitigating the spread. And so we'll continue to watch that and make sure that we're mitigating it appropriately. But as that unfolds, we'll make those decisions in real time in coordination with our mission partners.
Sir, you've gone through all the questions. I thank you and the Chief for your time. If you guys have any closing comments, now's the time.
Great. Chief, I'm going to give you first words.
Thanks again to the whole community, the Team Robbins, and the members of Middle Georgia. We will get through this. This virus is very difficult to defend. However, one thing that we can pass along, and one thing that can be contagious, is discipline, respect, and an awesome attitude. Sir?
I agree. So cautious courage is what I would offer, and encourage everyone to think about this is a formidable enemy, and we need to treat it as such. And we're going to win if we work through this together, if we follow the guidelines, if we're keeping each other accountable, and supervisors and commanders keep communicating with their people. Everybody is concerned from a personal perspective, and there's a lot of information flowing out there, a lot of circumstances that are in everybody's lives, whether it's those people who've been displaced because they were in a point of, PCS or TDY, or whether it's a family that has, some unknown financial concern because of this. Everybody has their own circumstances, which is why we have to connect with each other. Supervisors, first line supervisors have to be talking with their people on a regular basis, and commanders have to understand the circumstances and the variables surrounding their own specific mission sets, and they are empowered to make decisions on behalf of their people. Our country is behind the fighting force here on Robins Air Force Base. The information is available. I mean, whether it's on our website for Robins Air Force Base, the COVID-19 website, follow Facebook, the information that's being placed out there by the public affairs team. I also appreciate the 21st Century Partnership for some of the communication that they've been helping facilitate with community. The information's out there. Follow it, and then ask questions up your chain of command. Your supervisors will help you get those answers that are needed. And in the end, take care of each other, and we'll get through this together, and we'll win.